Good morning, students. Today we are going to describe vasculature of thyroid gland. In this brief session, I am going to describe arteries and veins of thyroid gland. Some MCQs at the end of this lecture are for revision and assessment. Thyroid is largest endocrine gland of our body. It receives its arterial supply from inferior and superior thyroid arteries. Accessory thyroid arteries also contribute to its blood supply. Thyroid is largest endocrine gland located in neck. This gland is highly vascular. It receives its arterial supply by paired inferior and superior thyroid arteries. In addition, it is also supplied by accessory thyroid arteries. Accessory thyroid arteries are branches from esophageal and tracheal arteries. Occasionally, thyroid gland is supplied by thyroid imma artery. It is drained by three veins, namely superior, middle, and inferior thyroid veins. Now let us go to this slide to explain the blood vessels of thyroid gland. Arteries of the thyroid gland are inferior thyroid artery, which mainly supplies thyroid gland, is a branch of thyrocervical trunk and is related to recurrent laryngeal nerve. It also supplies parathyroid glands. Superior thyroid artery arises from external carotid artery. This branch is related to external branch of superior laryngeal nerve. Occasionally, thyroid gland is supplied by thyroid imma, which is an aberrant vessel. This vessel arises from brachiocephalic trunk or from arch of aorta. Now, what are accessory thyroid arteries? Accessory thyroid arteries are branches of tracheal and esophageal arteries. Since thyroid gland is related to trachea and esophagus, the blood vessels of these structures also contribute to supply thyroid gland. Now, what are accessory thyroid arteries? Accessory thyroid arteries are branches from tracheal and esophageal arteries. Tracheoesophageal arteries divide into primary tracheal and esophageal arteries. Since trachea is related to thyroid gland, its blood vessels also contribute in supplying thyroid. Inferior thyroid artery is considered the principal blood supply of thyroid gland. It originates from thyrocervical trunk. Its branches are ascending cervical, inferior laryngeal, pharyngeal, tracheal, and esophageal arteries. Vessel is important because in addition to supplying the thyroid gland, it also supplies four parathyroid glands. It is related to recurrent laryngeal nerve and should be ligated as close as possible to the thyroid gland during thyroidectomy to preserve blood supply of parathyroid glands, which arise from terminal branches of inferior thyroid artery. Superior thyroid artery arises from external carotid artery in the neck. Its branches are hyoid, sternocleidomastoid, superior laryngeal, and cricothyroid artery. This vessel is related to external laryngeal branch of superior laryngeal nerve. It should be ligated as close as possible to gland as it acts as a guide for identification of external laryngeal branch of superior laryngeal nerve during thyroid surgery. In this animation, you can see the origin of superior thyroid artery from external carotid artery. Now, superior thyroid artery, as already said, arises from external carotid artery. On reaching the upper pole of the thyroid gland, it divides into two branches. One branch is for lobes of the thyroid gland and other branch is for isthmus of thyroid gland. This vessel supplies upper portions of each lobe and isthmus of thyroid gland. Thyroid gland, as already said, is drained by three veins. These are superior thyroid vein draining into internal jugular vein, middle thyroid vein drains into internal jugular vein, and inferior thyroid veins they drain into left brachiocephalic vein. In this animation, you can see the venous drainage of thyroid gland. Inferior thyroid artery should be ligated as close as possible to thyroid gland. This preserves blood supply of parathyroid glands. Now, some books mention that it should be ligated as away as possible to prevent injury to recurrent laryngeal nerve during thyroid surgery. So, if we ligate this vessel as away as possible from the thyroid gland, what are the consequences? So, we prevent injury to recurrent laryngeal nerve, which supplies all muscles of the larynx except cricothyroid. So there are no chances of hoarseness of voice and difficulty in breathing as a consequence of injury to recurrent laryngeal nerve. But at the same time, we do not preserve blood supply of parathyroid glands. So parathyroids lose their blood supply. So there is decrease in the serum calcium level and hypocalcemia. Now, if you want to preserve both recurrent laryngeal nerve and arterial supply of parathyroid glands, we should ligate inferior thyroid artery as close as possible to the thyroid gland, as shown in this diagram, so that blood supply of parathyroids remains intact and there is no post-operative hypocalcemia, and at the same time we preserve recurrent laryngeal nerve as well. Now, where should we ligate superior thyroid artery during thyroid surgery? Superior thyroid artery is related to external laryngeal branch of superior laryngeal nerve. Superior laryngeal nerve, which is a branch of vagus, gives two branches. Internal branch enters through thyroid membrane and supplies mucosa of the larynx up to vocal cords. External branch of superior laryngeal nerve is intimately related to superior thyroid artery. So during thyroid surgery, we ligate superior thyroid artery as close as possible to the thyroid gland because this vessel acts as a guide for identification of external laryngeal branch of superior laryngeal nerve, which supplies cricothyroid muscle. Cricothyroid is a tensor of vocal cords. Now let us go to this diagram to make things more clear. Superior laryngeal nerve gives internal laryngeal, which enters through thyroid membrane and supplies mucosa of larynx. Its external branch supplies cricothyroid muscle. During thyroid surgery, we ligate superior thyroid artery as close as possible to the thyroid gland in order to prevent injury to external laryngeal branch of superior laryngeal nerve. I want to summarize my lecture as thyroid gland receives its blood supply from pure inferior and superior thyroid artery. Accessory thyroid arteries also contribute. Occasionally, thyroid gland is supplied by thyroid imma artery. Imma means unpaired, which arises from brachiocephalic trunk or arch of aorta. This gland is drained by superior, middle, and inferior thyroid veins. Superior thyroid artery is intimately related to external laryngeal branch of superior laryngeal nerve, and inferior thyroid artery is closely related to recurrent laryngeal nerve. Injury to superior laryngeal nerve during thyroidectomy produces symptoms like low-pitched voice. Injury to the recurrent laryngeal nerve results in hoarseness and difficulty in breathing and stridor. To prevent these iatrogenic complications, both arteries should be ligated as close as possible to the thyroid gland during thyroidectomy. Let us go for a brief quiz based on this lecture. In order to preserve arterial supply of parathyroid glands, at what site should inferior thyroid artery be ligated? As close as possible to the thyroid gland, as away as possible from the thyroid gland, near the lower pole of the thyroid gland, near the upper pole of the thyroid gland. A is the correct option. As shown in this diagram, both superior and inferior thyroid arteries should be ligated as close as possible to the thyroid gland to preserve the arterial supply of parathyroid glands. Which of the following is the most important function of larynx? Phonation, swallowing, passage of air, passage of food. Passage of air is the most important function of larynx. Which of the following arteries mainly supplies blood to thyroid gland. Superior, inferior, accessory thyroidema. It is the inferior thyroid artery which mainly supplies blood to the thyroid gland. Which of the following artery is ligated as close as possible to thyroid gland during thyroidectomy? Superior, inferior, both, none. Both is the correct option. Thank you for watching this video. Do not forget to like, subscribe and share